Today, we have a very special guest joining us, Dr. Arwen Podesta. Arwen is a psychiatrist practicing in New Orleans. She's board certified in addiction psychiatry, holistic and integrative medicine, and forensic psychiatry. She works in both the public and private sectors. Now, not only that, as you know, Arwen is an esteemed member of the Psych Congress Steering Committee. Thanks for joining me today, Arwen.
Glad to be here. Thanks for doing this.
I trust that you and your loved ones are doing well during these difficult times.
We are staying safe, and my older family members that might have some immunocompromise or risk are all sheltered in place for many, many days, weeks, months.
That's very, very good news to hear that everyone's doing well. You know, I recently heard someone refer to this new era of COVID-19 as the new normal. And I suppose that is true, because this new normal, it's really requiring all of us to make a lot of changes, both professionally as well as personally. So I was thinking today, why don't we begin by talking about the professional changes that all of us, all of our Psych Congress family members are dealing with. So Arwen, what changes have you made in your practice in this new era of COVID-19?
I think it's a really great opportunity to look at how these changes, this electronic health system, and using Zoom, like this meeting, using telehealth, has really transformed practices. So one of the places that I'm medical director is an addiction intensive outpatient program, and we service currently we service 4 or 5 sites in the Louisiana area, and we take care of people with addiction. Everyone has to come to our office and do individual and groups. And because of this, we have actually expanded access because the regulations have been a little bit lax for being able to do telehealth. So we transitioned 2.5 weeks ago. We transitioned to, which, gosh, that sounds like such a short time overall. So in retrospect, we're going to be looking at 2.5 weeks, no big deal. But that was really early on in this shelter in place, or it was even before the shelter in place. We transitioned to all telehealth. And so we're able to accept new patients. We're able to accept new patients that might not be even near a clinic. And we're able to stay connected with our patients better because so many of our patients have no transportation, and they were struggling to take the bus or to get Medicaid to cover transportation. And they were missing at least, a third, if not half or 2/3 of their appointments. And so it was a real big shift in access and accountability for those that are really the most vulnerable, that have the least resources, but are asking for help. So that's the first big change that we've made, and that was the earliest one. My private practice and the addiction practice, we have used telehealth a fair amount in the past, but we didn't use a formal one that linked with our electronic medical record. And so this provided us with the impetus and opportunity to take that and really wield it. And so here we are today. I'm using Doxy at my office. I'm using Ring Central. I'm using VC. I'm using Zoom Clinic. And so we have all these platforms, and I just hope that this can stick, because in mental health, it's imperative to provide access to people in underserved areas. And so that's what I've done in my practice. We offer long-term injectables at my office as well. And so my nurse has to go in, but he's doing a very low threshold, very one patient coming in at a time, into the building at a time. He's doing the interviews either by Zoom or in the car, or by phone in the car. Drug screens are placed, and it feels a little cold because there's very little human interaction, but at least we have these videos. So he's doing long-term injectables all day today. It's been really helpful to feel like we can carry on. And my schedule has frankly been fuller than it would have been were I were this awful pandemic not occurring.
You know, Arwen, what, excuse me, what you just described, I think is true for many of us practicing clinicians, that this crisis has sort of disrupted the way we provide care. But I think, like you said, expanded access, that's a very good thing. And so maybe if we can balance the good with the less personal, we'll find a way over time to do that better. So thank you for sharing that.
I want to comment also that it's also putting a microscope on how systems don't work in telehealth and in healthcare. And I think that because of that microscope, there are people that are really trying to overcome these barriers. And we're coming together, just like we always do as humans during crisis. We're coming together to make things better, or to make things as best as they can. And I'm very hopeful that this is the new normal, not a pandemic, but an access expansion, an accountability expansion, a mental health availability, and systems working smoother with fewer barriers for patients that I didn't even know some of these barriers that have been highlighted during this crisis.
I like what you just said, in that new normal doesn't have to be a negative thing or something terrible. But new normal can actually mean something very good for the work that all of us are doing. Mm-hmm. You know, there's one other question, Arwen. As you were talking about the work you're doing in your addiction setting, this thought came to me because I remember that at the national meeting that we'll have in the fall in Nashville, I believe that you're going to be speaking a couple of sessions on substance use disorder. And this is the question that comes to mind. Are you worried that we're going to begin seeing patients who are turning to substances or to alcohol in an attempt to try to deal with anxiety, trauma, the losses associated with this crisis?
Yeah, I am. And it always happens. Let me tell you, this is kind of a back of the envelope statistic, not verified wholly. But after Hurricane Katrina here in New Orleans, we had about a fifth the number of people that lived here for the next year. People didn't come here to party. People didn't come here for vacation very much, but we had 10 times the liquor sales. So that, basic, simple math leads me to understand that 50 times each individual that was drinking approximately 50 times more. That's a lot. And so that is not unheard of in a crisis, during or after a crisis. I expect that. We were on a call with the DEA the other day that was related to what drugs are coming in, and the cartels and cocaine and fentanyl. It's not changing. People are still getting it. People are maybe taking a step back, but those that are struggling with addiction or trying to find a different way to cope are falling back on their addiction. And I don't expect any different than any other crisis. So, the interesting thing about this crisis is it is a pandemic. It is worldwide. And so not only are the people in one jurisdiction or one geographical area affected, everybody's affected. And so we're not going to have the push from, one safe area to push drugs into an unsafe area, So it's a different story than we've ever seen in our lifetimes, but it's still a problem.
You're so right. And I believe, Arwen, that the thing that we'll have to take as practicing clinicians is to remember that as we're talking with patients, to remember to ask those important questions, to remember to screen and have that at the top of our list to be checking in with our patients about substance use, alcohol use. Thank you for sharing that. So, Arwen, I wonder if you would share with us the top 3 learnings that you've experienced, whether they be professional or personal, in this transition time.
Sure. There's so much, and every day I probably have a new teaching to learn. And I have to start by saying I really love spending time at home. I love not having to drive all over Louisiana. I think I've put 5 miles on my car in the past 3 weeks instead of 100 miles a week. It's amazing. It feels less stressful overall. But that isn't to say that I don't miss seeing friends and family and going to restaurants, but I do love being home, and I love being able to be of service in my I love being able to be of service to my patients at home, from home, into their homes. And I think it's a remarkable thing that I didn't even think about, being able to video into someone's home and see what their life is like and what their life is really like. I saw someone and I asked her to show me around her space because she was known to continue using drugs while she was coming to our office. And so she showed me where she had cleaned out her closet full of leftover stuff. And so, it's a really powerful thing. It's a really powerful thing to be able to video chat into someone's home when you're trying to provide them with mental health. I've always been an advocate for those with mental health needs to leave the house and to come in and, be pro-social into a group setting or into an office setting. And I probably have learned something different about that. That might not always be, obviously it's not always available, especially right now, but it might not always be the most optimal when we can stay socially engaged and yet see into someone's home. So I think that was two things. So a third thing that I've learned is we are, as psychiatrists, we are so needed. And, when I chose the field of psychiatry, I really wanted to do this work and I love it and I connect with it. But in my residency, it was but in my medical school, it was kind of like a lesser seeming field for some. And I think that we have learned that it is not a lesser field at all. It's a very scientific field and a very needed field. And there's too few of us.
You're exactly right, Arwen, really on all three of your learnings. They speak to different things, all equally important. My guess is this: as you were talking, everything you said resonated deeply. My guess is the same will be true with our Psych Congress family at large. I wonder, I'm thinking about time. We have just a couple of minutes left, but I have one question that I don't want to miss it. Yes. So if you'll allow me to ask you just one more question today.
Yes.
You've already talked some about changes that you've made personally, stepping away from work a little bit. But I wonder, would you take just a moment to kind of, any other learnings that really come to mind personally, changes that you've had to make?
Yeah, well, it's more social interaction. I've always been a very social person, very connected, picking up the phone, making phone calls, texting, video chatting with friends and family. But that's the only option you have now. And so I'm doing it even more, and I'm roping in my husband to do it more. And so being able to be, proactive about checking in with people and staying connected. I think that's it. I think that's my biggest lesson for me is that you can be helpful, you can be friends, you can stay connected really well, and I guess the other thing is spending a lot of time in the kitchen. We're cooking a lot of really amazing gourmet meals, and we haven't had the time to do that in our household for ever as much as we have now. So that's a great thing.
I couldn't agree with you more, Arwen. The experience for us at home has been very similar, I'm sure, for all of our viewers today. But cooking more at home, doing things together as a family, what comes to mind is social distancing. It's just, social distancing is one thing, but it doesn't mean emotional distancing. We just have to be creative in how we connect, because that's going to be very important in getting all of us through this situation. So I want to take a moment, Arwen, and just thank you so much for joining us today, opening up your home, sharing with us changes both professionally and personally. It's just so important to all of us at Psych Congress, all of our attendees, all of our colleagues, to really hear how each other is taking care of these situations. So thank you again for joining me today.
My pleasure. Good to see your face and good to connect. And I look forward to another Zoom meeting or whatever platform we're going to use.
That sounds great. So for a moment, I'm going to turn my attention to our Psych Congress family members, and simply say our very best to each and every one of you. We hope that you stay healthy, be well. I'll talk with you really soon. So bye for now.